Eric Smith from Optimal Health Chiropractic in downtown Chicago. Today I'm going to have Dr. Priebe work on me. This time of the year, unfortunately, just like a lot of our patients, I've gotten some more congestion and some sinus issues, as well as contracted a little bit of a double ear infection. So I'm going to have Dr. Priebe work on me today so you can see what we do as chiropractors to loosen up what's going on in the sinuses, the ears, and all this. Obviously, you can get this type of congestion at any time of the year, but in winter, and for some reason right now, this time of the year in Chicago, we've gotten an extreme amount of patients and people complaining and wondering what they can do. So outside of medical intervention, he's going to show you a few things today that we do as chiropractors to kind of loosen this up and get me on the road to recovery. So, Doc?
Okay. So previously we did a full exam on him to be sure there's nothing else going on that might be contraindicated of him actually having an adjustment or us working on him. So typically in these kind of problems, I'm going to focus on looking at his upper back, making sure that's moving properly. Those nerves actually go to the lungs, so that's going to help him to breathe much more efficiently. We're also going to be looking at his neck to make sure that everything is moving properly. He doesn't have restrictions through, coughing and things like that, and poor posture. That's going to cause those segments to lock up and cause those nerves to actually, dysfunction going to his the region of his sinuses. Okay. So basically, what I'm going to have you do is I'm going to have you go ahead and lie on your back.
On my back? Okay. Definitely been coughing a lot of sinus congestion and building up.
So coughing is going to cause, a lot, your diaphragm and everything to work really hard, and those muscles can tighten and spasm and cause the joints to lock up, and that just further causes things to dysfunction. All right. So what I'm going to have to do, give myself a big hug. Just going to place my hand under here, his upper back. We're going to kind of palpate around, see what seems to be restricted. It doesn't seem too bad, but just kind of some gentle motions on him. Sometimes you're going to get some clicks and pops and things like that. Sometimes you don't. We want to make sure that everything's moving properly. The muscles aren't tight. If the muscles were tight, then I would recommend maybe some massage work or maybe doing some types of instrument work on there to help loosen those up as well. He seems pretty good. He's in good shape. Then I'm going to kind of take a look at his neck here. Just going to palpate around a little bit, test things, see how things are moving. Turn around and check these too. So usually mid-cervical spine seems to be the area that helps with improving function of the sinuses, going to help them open up, improve airflow. We're just going to do some real simple, easy adjusting in there. Yeah, see, he moves really nice. Someone that hasn't had chiropractic before, we're going to do a real comprehensive exam with them. Make sure everything is, good and intact, before we go doing any of this stuff. So I would do some soft tissue work, or have a massage therapist do something, or refer them to a massage therapist. We have massage therapy in our office here, so we're gonna do a little bit on him, make sure everything's moving good. Now, I would additionally recommend to the patients that they go home, they do have some hot shower running on their face at any time of the day. Doesn't have to be a long time, but also teaching them to do some good strong sinus massage under the zygomatic bone. That's going to help improve the function of the sinuses. You're really going to it's going to open them up and improve the flow, so you may get some discharge and things, so have tissues handy later. Also aggressively across the frontal bone above the eyes, that seems to help open up the sinuses as well. I can teach the patient to do this, so they're just going to take their thumbs and they're going to move it kind of down and aggressively, so your skin may get a little bit red. That's normal, but usually they can do this and they can put a significant amount of pressure on there to help open those up. as well, and of course across the front. You can do it at any time, doesn't have to be in the shower, but that will help to improve that as well. You can also do sinus rinsing. That really helps to keep the sinuses moist. When it's winter time and it's dry, especially in Chicago, it gets really cold, then it's going to get really dry in there, and those sinuses can swell. So that's pretty good.
Awesome. Well, thanks for explaining that, Doc. If you have any questions about if you could use this type of treatment, have a lot of sinus congestion, and it doesn't have to be seasonal. It can be something that's more chronic as well. Feel free to contact us below or send us an email. We'd love to answer any questions you have or get you scheduled so we can get you fixed up. We'll see you next time.